In a sprawling campus in Verona, Wisconsin, a single company controls the medical records of more than half of all Americans. Epic Systems dominates electronic health records, the digital systems that store every doctor's note, prescription, and lab result. Yet despite its reach, Epic operates quietly, shunning Wall Street, refusing interviews, and maintaining near-total control under founder Judith Faulkner. Now, that secrecy is cracking. Federal regulators, competitors, and healthcare providers are leveling accusations that could dismantle Epic's empire, that the company weaponizes its dominance to lock in customers, block data, and crush competition. Epic's ascent began in the early 2000s when the federal government poured billions into digitizing healthcare. According to Kloss Research, Epic captured major hospital systems by offering a comprehensive platform that integrated every aspect of patient care. By 2024, Epic held 54% of the acute care hospital market, according to healthcare data analysts. The company's nearest competitor, Oracle Health, held just 17%. Epic became the standard, so dominant that switching became unthinkable. Hospitals invested hundreds of millions in Epic implementations. Once in, they rarely left. Critics say that's not by accident. The core accusation against Epic is data blocking, the practice of making it difficult or expensive for patient information to move between systems. In 2022, Particle Health, a data-sharing startup, filed a federal antitrust lawsuit alleging Epic used its dominance to restrict competitors' access to patient data. According to court filings, Epic allegedly blocked Particle's requests for medical records, citing vague security concerns. Particle argued Epic's real motive was to protect its own data exchange product, Care Everywhere. The lawsuit claimed Epic violated the Sherman Antitrust Act by leveraging monopoly power to exclude rivals and maintain control over healthcare information flow. In February 2024, the Federal Trade Commission launched a formal investigation into Epic Systems. According to Politico, the FTC is examining whether Epic engaged in anti-competitive practices by restricting data access and using exclusivity clauses to prevent hospitals from integrating rival software. The investigation followed complaints from multiple health tech companies and culminated in FTC staff issuing a civil investigative demand, essentially a subpoena, for internal Epic documents. Legal experts say this signals the FTC views Epic's conduct as potentially violating Section 5 of the FTC Act, which prohibits unfair methods of competition. The investigation remains ongoing. Epic Systems has vigorously denied all allegations. In public statements and court filings, Epic argues it complies fully with federal interoperability rules and that its data sharing restrictions are necessary to protect patient privacy and security. According to Epic, Particle Health and similar companies exploit regulatory loopholes to access records without proper patient consent. Epic has characterized the lawsuits as attempts by competitors to force access to Epic's proprietary infrastructure without contributing to its costs. In the Particle case, Epic filed counterclaims alleging Particle misused treatment data for non-treatment purposes, violating HIPAA regulations. Epic maintains it welcomes competition but refuses to subsidize rivals. At the heart of the battle is the 2021 Cures Act rule, which mandates that health IT vendors cannot engage in information blocking. The rule requires systems like Epic to provide access to electronic health information through standardized interfaces. But implementation has proven murky. According to healthcare policy analysts, Epic technically offers data access through APIs and its Care Everywhere network, but critics say the requirements are so cumbersome and expensive that they effectively deter competition. Small startups report facing lengthy contracts, unpredictable fees, and technical barriers. Whether this constitutes illegal blocking or legitimate security measures is now the central legal question. Epic's dominance extends beyond market share. According to a 2023 analysis by healthcare research firm Black Book, Epic holds 92% of the academic medical center market and 74% of hospitals with more than 500 beds. Competitors including Oracle, Cerner, Meditech, and dozens of smaller vendors struggle to win contracts against Epic's installed base. Industry insiders say the switching costs, often exceeding $100 million for large systems, create a de facto lock-in. This concentration worries regulators. A single vendor controlling the majority of health data creates systemic risk and reduces innovation incentives. The outcome of these legal and regulatory battles could reshape American healthcare technology. If the FTC concludes Epic violated antitrust law, remedies could range from fines to forced interoperability mandates or even structural breakup. The particle lawsuit, currently in discovery, could set precedent for how courts interpret data blocking under antitrust law. Meanwhile, Congress is considering new legislation to strengthen interoperability enforcement. Healthcare policy experts predict the resolution will take years and likely reach appellate courts. For patients, the stakes are immediate: fragmented records, delayed care, and innovation stifled by a dominant gatekeeper. The question is whether regulators can unlock the data, or whether Epic's defenses will hold. Epic Systems is a paradox, a privately held company with public consequences. It answers to no shareholders, publishes no financials, and operates with minimal transparency. Yet it controls infrastructure critical to national health. The antitrust scrutiny Epic now faces reflects a broader reckoning with tech monopolies across industries. Whether Epic's model, tight integration, proprietary standards, vendor lock-in constitutes a legal monopolization or simply successful business strategy is the question courts and regulators must answer. The healthcare system, already strained, watches closely. The resolution will determine whether medical data becomes a truly interoperable public resource or remains locked behind the walls of Verona, Wisconsin.